Assalamualaikum. यूनिट फॉर स्किन हेड एंड नेक असेसमेंट। ये हेल्थ असेसमेंट थर्ड सेमेस्टर का यूनिट नंबर 4 है। फास्ट रीडिंग करते हैं। ऑब्जेक्टिव: बाय द एंड ऑफ दिस योर लर्नर विल बी एबल टू डिस्क्राइब द कंपोनेंट ऑफ हेल्थ हिस्ट्री दैट शुड बी elicited during the assessment of skin, head and neck. Describe specific assessment to be made during the physical examination of the above system. Objectives: apply Braden scale to assess the bed source of patient, document finding, describe age related changes in the above system and difference in assessment finding. Anatomy of the skin: first epidermis, stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, stratum basala या stratum germinative, hair shaft, sebaceous gland, epidermis, dermis and subcutaneous tissue. There is the apocrine sweat gland, hair follicle, erector pili muscles, adipose tissue, veins, arteries, eccrine sweat gland, connective tissue. मैं ज़्यादातर फास्ट रीडिंग करता हूँ और उर्दू में इसके बाद लेक्चर्स होंगे। एनाटॉमी ऑफ द स्किन: लेयर्स ऑफ स्किन, एपिडर्मस thin divided into two layers, outer layer dead keratinized cells, inner cellular layer melanin and keratin formed. Dermis: well supply of the blood, contain connective tissue, sebaceous gland and hair follicle. Subcutaneous: contain fat, sweat glands, remainder hair follicles. Skin appendages: hair, nails, sebaceous gland, sweat glands. Functions of the skin: regulates body temperature, prevents loss of essential body fluids, protection of the body from harmful effects of the sun and radiation, excrete toxic substance with sweet sensory organ for touch, heat, cold, socio-sexual, emotional and sensation. Nursing history of skin: pain or itching, presence or spread of any lesion, pigmentation spot, previous experience with skin problems, family history. History: use of medication, lotion, home remedies, excessive dry or moist, tendency to burst, occupation, contact with allergens. History: reminder to look at each history component as it relates to the integumentary system. Ask the patient the following: do you have changes in moles or other lesions, non-healing sore or chronic ulceration, pruritus, itching, rashes, changes in skin, hair or nails? Do you have any food, drugs, environmental allergies? Do you have any medical problem? Are you on any medication prescribed or over the counter? Examination approach: the techniques should in the examination of the integuments are inspection and palpation. As you conduct the assessment along with your sense of sight and touch as your sense of smell to note any unusual odor. It is important to inspect all areas of skin including intertriginous area which lies between or under folds of skin. Throughout the examination, compare symmetrical parts. Also be aware of the feel of the skin, hair and nails. You can inspect the skin in one of three ways: using a head-to-toe approach, observing all skin on the anterior, posterior, and lateral surface of the body. Inspect the skin by regions as you examine cardiovascular, respiratory, and other system. Physical assessment equipment: gather equipment needed for the exam: gloves, pen light, ruler, marker, magnifier, position. Assess all areas, change position as needed. Technique: first scan your patient, checking for specific signs of disease affecting other organ systems that might alter the skin, hair or nails. Techniques of examination: assessing color, skin color, increased pigmentation, loss of pigmentation, pallor, light skin, pupil evident in the face, conjunctiva of the eyes and nails, cyanosis evident in nails, pad, lips and buccal mucosa, jaundice, the yellowish sclera of the eyes, mucous membrane and skin is evident. Inspection of the skin. Color assessment technique: normally variations. Inspect both exposed unexposed areas of the color. Difference center cyanosis from the peripheral cyanosis by inspecting oral mucosa and conjunctiva. Gently pull lower eyelid down to examine conjunctiva. Color inspection of the skin color. Assessment technique: normal variation, uniform skin color with slightly dark exposed area, racial difference account for many variations in skin color, mucous membrane and conjunctive pink. Order assessment technique: normally variations, note unusual order, no unusual order, abnormal finding, irrational, unusually body odor, poor hygiene or underlying disease. If from poor hygiene may be related to self-care deficit that warrants nursing intervention. Order from excessive sweating, hyperhidrosis, possible thyrotoxicosis, orders from the night sweat, possible tuberculosis, urine odor, incontinence problems, style urine odor may be associated with uremia, Meucci odor, या liver disease. Techniques of examination: arrhythmia, redness with variety of rashes. एरिथमिया इज कॉल्ड जब ब्लड स्किन पर नज़र आ रहा हो तो उसको एरिथमिया. एडिमा, स्किन appears swollen, shiny, moistures mean moistures, dry, oily, temperature cool, warm, textures roughness or smoothness, mobility, and turgor mean elasticity. Skin lesions, inspections of the skin lesions, abnormal finding relation, classify lesions as primary and secondary. Primary lesion is an initial alteration in the skin. Secondary lesion arise from the changes in the primary lesions. Through descriptions of lesions should include morphological, clinical description, size, shapes, color, texture, surface relationship, exudate, tenderness, configurations, location, and distributions. For vascular lesions, also note pulsation and blanching. Types of lesion: primary lesion, secondary lesion, in response to change in the internal or external environment due to the trauma, infections of the primary lesion. Primary lesion surface characteristic: lesions flat, non-palpable, example cherry angioma, freckle, flat mole, lentigines, melanoma, petechia, scarlet fever. This is their example. Macula less than 1 centimeter, pitches greater than 1 centimeter. uh, Birthmark, CF, lith spots, closma, mongoline spot, port wine strain, tinea versicolor, vitiligo. Palpable, raised but superficial, example basal cell carcinoma, sarcoma, lesion planus, psoriasis, raised mole, seborrheic, and keratosis. Palpable less than 1 centimeter. Primary lesion, surface characteristic, lesion and example: raised, superficial, temporary, example allergic reaction, hivers, and insect bite. Palpable, solid with depth into dermis, example Bartholin cyst, arrhythmia, nodosomes, keratogenous cyst, uh, lipoma, xanthoma. Nodule less than 2 centimeter, a fluid filled and encapsulated called cysto. Palpable, fluid filled, blister, contact dermatitis, herpes simplex, example blister, burns, contact dermatitis, and bulla greater than 1 centimeter and vesicle less than 1 centimeter. Example acina vulgaris and folliculitis, impetigo. Secondary lesion, surface characteristic, lesion and example: thickening and scarring with increased skin marking, example contact dermatitis, eczema, lipoma, and psoriasis. Secondary lesions that added to will be lichenification, contact dermatitis, shedding. Dead skin cells, scales can be either dry or oily, adherent or loose, variable in color, example psoriasis is with the scales and psoriasis this see in पिक्चर में जो नज़र आ रहा है. Dried exudates, example dried herpes simplex, impetigo. This is the dried herpes simplex. Replacement connective tissue formations, example surgical site and trauma sites. Surface characteristic, lesion, example hypertrophic scarring because of excessive collagen formations, raised and irregular, example piercing site, keloids, surgical site, and tautolobicloid. abrasions and other loss that does not extended beyond the superficial epidermis. Example: atopic dermatitis, exorations, starch mark, insect bite, scabies, stasis dermatitis, vascular ruptured site, secondary lesion, and the excursions from the uremic pruritus. Loss of superficial epidermis. Example: abrasions, candidias, erosions, dermatopite infection, fragile skin, impetigo, intertrigo will be the candidias. Secondary lesions, surface characteristics, linear breaks in the skin with well-defined borders may extend it to the dermis. Example: athletes' foods, cheilitis, hand dermatitis, chipped hands, and syphilis. Irregular shaped loss extended to or through the dermis may be necrotic. Example: pressure ulcer and stasis ulcer. Thinning of skin with a transparent appearance and loss of marking. Example: aging, arterial insufficiency, topical corticosteroid. Vascular and purpuric lesions of the skin. Cherry angioma, spider angioma, spider vein. Appearance इसका किस तरह है? चेरी एंजियोमा का इसका appearance किस तरह है? इसका appearance. Risk factor for pressure ulcer: impaired mental status, impaired nutritional status, sensory deficit, immobility, mechanical forces, shearing and fractions, increase by temperature, excessive exposure to moisture from bodily secretions such as urinary and fecal incontinence. Staging criteria for pressure ulcer: stage 1, stage 2. Appearance and characteristics. Stage 1 का characteristic: non-blanchable arrhythmia of intact skin, indication potential of ulceration. Second, partial thickness loss involving both epidermis and dermis. Ulcer is still superficial, appears as plaster. Abrasions are very shallow crater. Stage 3, full thickness loss involving subcutaneous tissue. Ulcers may extend to but not enough fascia, a deep crater that may undermine adjacent tissue. Stage 4, full thickness loss with extensive involvement of muscles, bone, supporting structure. This deep ulcer may involve undermining and sinus tract of adjacent tissue. Pattern and configuration of lesion. Pattern: rounded oval. Descriptions and example: cone and oval shaped as in nemular eczema. Discrete lesions that remain separate and apparent are common in many skin disorder. Moles, nevi, and are an example. Group lesions that are grouped are clusters such as herpes simplex. Confluent lesions that run together are confluent are common in childhood disease as rubella. Pattern, description, and example: linear and annular, circular. Lesions arranged in lines are common in contact dermatitis due to poisons, avi and herpes zosters. Ring-shaped lesions may be ringworm. Example is that. Acriform lesions arranged in partial rings or arcs occurs in syphilis. Aris, a bull's-eye lesions, round lesions with central clearing and typical in arrhythmia, multiform, and Lyme disease. Gyrate lesions have serpentine configurations as in gyrate arrhythmia. Polycyclic, collicid, concentric circle such as urticaria. Distribution of skin lesions. Area, descriptions and example: diffuse, generalized. A lesion described over the entire body as a urticaria from allergic reaction. Scattered, lesions that are sparely distributed as in seborrheic keratosis. Localized, lesions in very limited discrete area. Localized may indicate contact with an allergen or wheal from insect bite. Regional, head, confined to a specific body area. tinea capitis. Torso, petaresis rose, and extensor surface sorosis. Flesher surface, intertigo, dermatome, herpes zoster. Hairy, hairy areas, herpes 2, pediculosis pubis. Intertriginous area, folds of skin, contact dermatitis, diaphoresis, intertrigo erythema, and scaling of the body folds. Palpation of the skin, temperature, assignment techniques, normal variation, compare side to side using the dorsal aspect of your hand, skin warm, temperature varies depending on the area being assessed. For example, exposed areas may be colored than unexposed area. This is the temperatures to check. Abnormal finding and rational local area with increased temperature, inflammatory process, infection or burn caused by increase lesion or area, generalized increase in temperature, fever, localized area with decreased temperature, decreased circulation to area with arterial circulation, generalized decrease in skin temperature, exposed or shock. Moisture assessment technique, normal variation using light palpation to assess skin moistures depend on environment condition and patient age. Elderly people have drier skin because of decreased sweat production. Exposed area are usually drier than unexposed area. Also, moisture varies according to body area. For example, the axial are usually more moist than other areas. Abnormal finding, rational increased moisture, fewer thyro, uh, thyrotosis, decreased moistures, dehydrations, myxedema, and chronic nephritis. Palpation of the skin texture, assessment technique, normal variation, use light palpation to assess textures, varies from soft and fine to coarse and thick, depend on area assessed and patient age. Exposed skin usually not as soft as unexposed. Extensor surface such as elbow have coarser skin. Usually the younger the patient, the softer the skin. So infant have very soft skin. Abnormal finding, coarse, thick, dry skin, hypothyroidism, skin that become more fine textures, hyperthyroidism, smooth, thin, shiny skin, arterial insufficiency, thick, rough skin, venous insufficiency. Turgor assessment technique, test turgor by gently patching a fold of skin on unexposed areas such as elasticity decreased with age. Exposed areas may have less turgor. Helpful horn turgor is often used to assess hydration status, but because turgor decreases with age, it is not a useful tool for assessing hydration status in elderly people. The elderly client, the elderly client. Physical changes of the skin, loss of turgor, appearance of wrinkles, skin appear thin and translucent. The skin is dry and flaky because sebaceous glands are less active. Hair and nails. Hair nursing history focus on curling or straightening, recent chemotherapy, presence of disease, hypothyroidism, thin hair. Nails nursing history focus on previous illness or injury, peripheral circulatory disease, excessive thickening. Examination of nails. Inspect and palpate of nails and toy nails. Adherence to nail beds, color, cyanosis, pillar, counter and shape, clubbing, angle greater than 160, symmetry and thickness, cleanness and lesion. Clubbing, normal finger is 160, clubbed finger greater than 180. Fingernails, clubbing, peronchia, dorsal planx rounded and bulbous, convexity of nails plate, increase angle between plate and proximal nail fold increase to 180 or more. Proximal nail folds feel spongy, many causes including chronic hypoxia and lungs cancer. Inflammation of the proximal and lateral nail swells, acute or chronic, full red, swollen, may be tender. Onycholysis, pinless separation of nail split from nails bed treating distally many causes. White tissue with a distal pad of a reddish brown seen in aging and some chronic disease. Leukonychia. Leu- Leukonychia, white spots caused by trauma, they grow out with nails, transverse white lines, curved white lines similar to curve of a Lonola. They follow an illness and grow out with nails. Examination of hair: quality, quantity, distribution, cleanness, pattern of loss, infestation. Inspection of the hair: scalp hair distribution, assessment technique, normal variation. Inspect hair quantity and distribution, assess area for the pattern, note whether there is actual hair loss with the smooth skin beneath, whether hair has been broken off near the scalp with the palpable stable over the skin. True hair loss occurs in many conditions. Gender, age, and genetic affect hair distribution. Hair should be evenly distributed. Exceptions are normal balding pattern common to men or persons of advanced age. Hair thins with age. Generalized hair loss, nutritional deficiency, hypothyroidism, lupus, erythematosus, thyroid disease, and in response to disorder situations that stress integumentary system, such as serious illness or side effects of medication, alopecia associated with alopecia areata and trichotillomania, and fungal infections such as tinea capitis. Infection of the hair, body hair assessment technique, fine body hair, vellus noted over the body, gender, age, genetics influence amount of hair. Men usually have more hair on the chest. Puberty marks the onset of pubic hair growth and increased growth on legs and axilla. Abnormal finding. Hirsutism, usually caused by the endocrine disorder, medication such as steroid. Hair in male, pattern in female, for instance, axis, facial, or trunk hair. Assessment technique: inspect hair, wide range of normal color variation, gray color occurring with aging, condition of scalp, inspect scalp intact and free of lesions and pediculosis. Abnormal findings: scaling of scalp, dandruff, seborrhea, psoriasis, certain tinnitus, and eczema, atopic dermatitis. Palpations of the hair and scalp assessment technique: use light palpation to assess hair. Use light palpation to assess scalp, scalp movable and non-tender. Genetic influence hair texture. Abnormal finding: dry, coarse hair, hypothyroidism, fine, silky hair, hyperthyroidism. Tenderness may indicate a localized infection. Inspection, palpation, skin. Inspect, color, odor, integrity, lesion if found, describe morphology, distribution, pattern, and localization. Palpate temperature, trigger, texture, moisture. If lesion found on inspections, palpate them for textures, tenderness, pulsations, and blanching. Here, inspect color, quantity, distribution, condition of scalp, lesion, and pediculosis. Palpate texture, scalp for tenderness, mobility, nails. Inspect color, condition, shape, angle of attachment. Palpate textures, capillary refill. Document your finding. Head anatomy, फेशियल बोन एंड द ये पूरा स्कल है. फिर इसमें बोन फेस के 14 बोन्स हैं और 8 जो हैं वो हेड के हैं. इसको नेम दिया है तो ये मैंडेबल, मैक्सिला, जाइगोमेटिक बोन, नेजल्स बोन, स्पिनॉइड बोन, फ्रंटल बोन, coronal status, parietal bone, sagittal suture, squamous sutures, and lambdoid suture, occipital bone, temporal bone, external acoustic meters, mastoid process, CN1, cranial nerve 1, cranial nerve 2, cranial nerve 3. Paranasal cyanosis, frontal, ethmoid, sphenoid, maxillary, adult. Paranasal cyanosis, frontal, ethmoid, sphenoid, and maxillary will be sphenoid, maxillary, ethmoid, and frontal. This is the parotid duct, sublingual gland and ducts, submandibular gland and ducts will be the hard bone, right thyroid lobe, isthmus, thyroid cartilage, cricoid cartilage, left thyroid lobe thyroid gland will be cerebellar and parathyroid gland, sublingual gland and submandibular gland. This is the posterior auricular, occipital, superficial will be the posterior cervical, will be the preauricals, tonsillar, submental, deep cervical and supraclavicular. Head anatomy: frontal bone, temporal bone, parietal bone, occipital bone, nasal bone, parotid gland, submandibular gland. Health history: identify any related symptoms, risk factor, that presence of disease involving. It must also detect any other disorder that may affect these structures. Health history include biographical data, patient current health, past health history, family history, psychological history, and review of symptoms. Symptoms analysis: headaches, jaw tightness and pain, neck pain and stiffness, neck mass, nasal congestions, nasal bleed, mouth lesion, mouth and dental pain, sore throat, and hoarseness. Case study finding: review biographical data. 17-year-old unmarried male worked part-time in fast food restaurant. Born in United States, was adopted immediately after birth. Protestant religion. Father is computer salesman and mother radiology technician. Source self-reliable. Current health history: describe current health and excellent. See, he is health directed and wishes maximum health. No current complaint, although he high fever is spring and fall. He is not currently experiencing any symptoms, but generally has several weeks, sneezing, runny nose, itching, eyes, head congestions. Antihistamine generally control symptoms. One rare occasions a time heard then in fall springs. He has symptoms that last several hours, but he is not sure what triggers them. Past health history: usually childhood illness with complaints, tonsils and adenoid removed at age 4 after frequent throat infection. Tympanoplasty age 3, frequent ear infection, immunization up to the date, tetanus updated last year when he stopped on piece of glass while avoiding seasonal high fever since childhood. Take OTC antihistamine when he is prescribed antihistamine on hand, but usually takes clethodim during seasonal allergy. He always taken multivitamin daily, takes no other medication, no recent exposures, unknown infections. Notes that he works busy restaurant, attend public school. He could expose to whatever going around. Family history: review of system and hand tolerant swimming. इसको skip करते हैं, फिर टाइम ज़्यादा लगता है. Psychological profile: baths daily, use no cosmetic on face, other occasional OTC as in medication. Topical day starts 6 when he mother awaken him to get ready for school, attend school from 8 a.m. No, just reading. Approach: all four techniques of physical assessment, inspection, palpation, percussion, and auscultation are used in examination of the head, face, and neck. Some fractures like the throat and internal nose can only be inspected. Generally, only the sinuses, percussed, and only the vessels of the neck and thyroid are auscultated. The tools that will be necessary to examine the hand, face, nose, mouth, throat, neck are pin light, otoscopes for focused light, tongue blades, gauge stethoscope, and transluminar nasal speculum, cup of water, and gloves. This is the inspection of the head and face. Head size: inspect head size, shape, symmetry, and facial features. Variation in between the within the gender and ethnic group. Abnormal increased head size in young child may indicate hydrocephalus. Inconsistently enlarged head size is adolescent or adult may indicate acromegaly. Head shape: variation is wide, although shape should be symmetrical and counter rounded. Abnormal finger asymmetry of shape and counter previous trauma, surgery, or congenital deformity. Assessment technique: facial appearance varies by gender, age, and ethnic group. However, there should be symmetry of features and movement. Abnormal finding: facial appearance inconsistent with gender, age, or ethnic group may indicate inherited chronic disorder, may typical such as Graves' disease, hypothyroidism with myxedema, Cushing syndromes, and acromegaly. Asymmetry of feature, previous trauma, surgical alterations, congenital deformity, paralysis, edema. Asymmetry is also been with Bell's palsy and stroke. Bell palsy asymmetry of the movement suggest neuromuscular disorder या paralysis. Tax Spastic muscular contraction usually occur in the head and face. Head contour and facial structure. Palpation of the head and face. Usual use light palpation to note head size, shape, symmetry, mass, areas of tenderness. Use light palpation to palpate scalp's mobility. No tenderness, lesions, relative smooth, and no unexpected contour. Assessment. Palpate TMJ by placing finger over the TMJ and palpating joint to patient opens closes on her mouth. Smooth symmetrical with no pain, crepitus or clicking. Frontal and maxillary cyanosis. Inspect frontal cyanosis above the eyes and maxillary cyanosis below the eyes. Uh, no periobital edema and discoloration. Abnormal periobital edema and dark underlying circle sinusitis. Frontal sinus normal, red glow and noted above eyebrow. Maxillary cyanosis normally red glow needed roof. Expect variations include absence of transluminations because ability to transluminations depend on the thickness of the bones and hourly structures. Abnormal finding absence of the transluminations over the cyanosis when the spot structures transluminations mucosal thickness sinus fullness with sinusitis absence transluminations must be considered with the other finding. Frontal and maxillary cyanosis. Palpate frontal cyanosis by pressing upward just below eyebrow, no tenderness. Palpate maxillary cyanosis by passing below eyes, no tenderness. Frontal and maxillary cyanosis. Frontal cyanosis with the direct immediate percussions above eyebrow. Percus maxillary cyanosis with direct immediate percussions below eyes. External nose, note size, shape, symmetry, mid and placement shape symmetrical and consistent with age, gender, and race, ethics groups, no nasal flaring, and no drainage. Internal nose mucosa abnormal finding, bright red mucosa inflammation from rhinitis sinusitis also suggests cocaine abuse. Pale dry mucus allergic rhinitis copious or colored discharge allergic infection disorders, epistasis nostroma, cluster vesicles, herpes infections, ulcer or perforations, chronic infection, trauma or cocaine use, diarrhea, crusted blood, previous epistasis, polyps, elongated, rounded projections, allergies, irritations, chronic infections, divided septums, normal variant following trauma. External nose, occluded each nostrils and note patency. Cartilaginous portion is slightly mobile, non-tender, no mass, Neris patients. Deviations are masses, previous trauma or infection. Lips, inspect color, condition, lesions, order, midline, symmetrical skin, intact, pink, moist, coloring consistent with ethnic groups and with non-usual orders. Abnormal finding, asymmetrical placement, congenital deformity, trauma, paralysis, surgical alterations, pallor, anemia, redness, inflammation, infection disorder, cyanosis, vasoconstrictions, hypoxia, lesion, infection, inflammatory disorder, cheilitis, inflammation of lips, drying and crickles, dehydration, allergy, lips and chelosis, fissures, concern of lips, deficiency of vitamin B vitamins, and macerations related to our closure. Teeth and bite. Have patient open close mouth, note occlusion number, color condition, and teeth. Most adult have 28 teeth, 32 if the third molar or wisdom teeth are erupted. However, they are usually impacted. Teeth should be white, not loose, with good occlusions and in good repair. Abnormal finding, various abnormality include loss, poorly encoded teeth, and malignancy, dental caries. Inspect color, condition, lesions of mucosa, note condition, and gingiva, bleeding, retractions or hypertrophy. Pink, moist, intact mucosa, color variant acceptable if consistent with patient's ethnic group. Instance, dark stiffening and dark Jams consistent in color with the other mucosa and intact with no bleeding. Abnormal finding: jam hyperplasia, side effect of medication such as a dilanth or calcium channel blocker, gum recession, inflammatory gum changes, gingivitis, periodontal disease, poor dental hygiene, and vitamin deficiency, pale argyri gingua, chronic gingivitis. Assessment: hard and soft palate. Inspect color conditions of hard and soft palate. Palpate intact smooth pink, bony mucosa, covered projections on the hard plate, floor of mouth, and normal variations. Perforations congenital from trauma or dry use drug use. Inspect color, textures, moisture, and mobility. Pink and moist color may vary consistent with the ethnic group. Mucosa intact with no lesion and discolorations. Papilla intact. Tongue freely and symmetrical. Mobile. CN12 intact. Geographic tongue is a normal variation. Oropharynx assessment technique: inspect oropharyngeal color, lesion, and drainage. Mucus is pink, moist, intact, and lymphoid ridges. Posterior wall may have the slightly irregular surface. No lesions, arrhythmia, swellings, exudate or discharge. Tonsils: locate tonsils, pustules to arches on sides of throat. Note color, size, and exudate. Symmetrical pink, clean cryptus, and cryptus may have normal variations of small food particles. Tonsillar or bulges adjacent to the tonsillar pillars, enlarged tonsils with exudates. Redness, hypertrophic tonsils without exudate. Acute infection, tonsillitis, lymphoid clustering. Assessment technique variations: have patient say and note symmetrical rise of vulva, midline pink, moist, without lesion. Symmetrical rise of vulva, CN9 glossopharyngeal and CN10 vagus intact. Abnormal finding: arrhythmia, exudate, lesions, infection process, asymmetrical rise of vulva, problem with the CN9 and CN10. Tonsil grading scale: tonsil extended to arches, tonsil extended just beyond arches, tonsils approximate the vulva, tonsils meet midline. दिस इज द फोर, ये टॉन्सल्स की फोर स्टेजेस हैं, +1 +2 +3 एंड +4 एज यू सी इन डायग्राम. Palpation of the mouth and throat. Lightly palpate lips for consistency and tenderness. Soft, non-tender, no masses. Will be tongue. Lightly palpate tongue for consistency and tenderness. The tissue is soft without masses. Nodule thickening, tenderness. Tissue is soft. Supply without nodules, thickening, masses, tenderness. Sublingual glands may be palpable under the tongue but should be non-tender, soft, supply, simple. Glands: parotid, submandibular, and sublingual. Parotid palpate in front of areas, submandibular and sublingual palpate under the mandible. Palpate glands are non-palpable and non-tender. Submandibular and sublingual glands may be palpable but should be non-tender and soft. Enlarged tender parotid gland, parotitis, and blocked ducts, infection, and malignancy. Neck, lymph nodes, and thyroid. Inspect neck in neutral and hyper extended position and patient swollen. Inspecting the neck from the neutral position. Inspect the neck from hyper extended. Inspect the neck when the gland swollen water. Neck erect, midline, no lumps, bulges, or masses. Thyroid not visible, no masses, swelling or hypertrophy in mid or lower half of interior neck. Palpation of the neck. Use a light palpation. Check masses, areas of tenderness, tender and masses. Abnormal finding: masses, lymphadenopathy, and malignancy in thyroid masses. Assessment cervical nodes. Assessment of cervical nodes: occipital nodes, posterior auricular nodes, pre-auricular nodes, tonsillar node, submandibular node, submental node, and superficial cervical node. posterior cervical node and deep cervical node. Superficial cervical node, posterior cervical node and deep cervical node. Supraclavicular node, infraclavicular node, lymph nodes normally. Assessment: thyroid. Locate the thyroid isthmus below the cricoid cartilage. Anterior approach. Thyroid continue. Thyroid: if thyroid gland is palpable, the patient's hold breathe and then listen over the thyroid gland with the bell portion of the stethoscope outwards. No sound detected. Abnormal increased vascularity of hyperthyroidism. This is the end of our lecture. Is the fast reading. Thank you. Allah Hafiz.